Hello everybody and welcome back to my vlog. So today I'm going to do something a little bit different to what I normally do. I'm actually going to talk about a decision that I had to make recently and why I had to make it. And that was making the decision as to whether or not to have a caesarean section to deliver my baby. And as you know, that was very recently. I actually had my baby by caesarean 5 weeks ago. So why do I want to talk about this? Well, it's become apparent to me in this whole process, which was a difficult one. It was a difficult decision to make, that lots of women are faced with this and they often just don't know what to do or even what the C-section process actually is, on how it happens and what happens afterwards. So I thought I'd talk about my experience. So I am going to give a few facts and figures about risks, but anything else I say today is just my personal experience, and everybody is different, so everybody will experience it differently and make a different decision necessarily to me. So I had no plans to have a caesarean when I got pregnant. And that was because 29 years ago I was pregnant and I delivered my son, who was a big baby, normally, so vaginally, and it was easy. I found it quite simple and straightforward. My labour wasn't that painful and my delivery was quick. So in my head I just thought that's exactly what would happen this time. The only difference this time was I was carrying some major risk factors. And they were that I'm 51 when I delivered, I was 50 when I got pregnant, and I don't have a thyroid, so I'm hypothyroid and I take thyroxine. So those are two reasonable risk factors for the pregnancy as a whole. I also have a reasonably low BMI, and that also came into the decision-making process in the end because it affects the size of the baby. So today I'm going to talk about how it was for me and how I made the decision and why. So let's talk initially about the risks of a vaginal delivery. Are there risks? Well, of course there are. There are risks for anything. And even in today's day and age, and even in the Western world, being pregnant and having a baby is still the most dangerous thing a woman ever does. So none of it is straightforward, as beautiful as it is, and all of it needs to be thought about. So what are the risks of a vaginal delivery? So tears. So as the baby is born, you can tear the skin around the vagina, and they can be minor tears, grade 1 or grade 2, or they can be more serious, grade 3 or 4. And grade 3 or 4 can involve the bowel and the bladder, the perineum, and they can actually leave you with long-term consequences of those tears. You can get pelvic floor damage just from being pregnant yourself or from the birth itself. And that can include long-term incontinence, so you have problems holding urine either all of the time or when you cough or laugh, or even as much as constant and permanent pain around the perineum, and that's the bit between your vagina and your bum. You can get injuries to the baby as it travels through the birth canal. So big babies are at risk of what we call shoulder dystocia, so getting stuck in the birth canal, and that is a risk. Because that can deprive them of oxygen, they need to be delivered quickly, the doctors may have to break the baby's collarbone to get it out, or even go to an emergency caesarean section. The babies can get bruised, and obviously in the worst case scenario, babies can get starved of oxygen as they stay in the birth canal too long or something happens, the cord gets compressed, and that can cause a hypoxic brain injury. And then obviously the worst case scenario is a stillbirth. So there are risks to a vaginal delivery. But having said that, there are also risks to a C-section, and probably more. So obviously you have a longer recovery time with a C-section, and you can potentially be longer in hospital. But once you're out of hospital, the recovery time can be up to 2 months. You have pain. You can get infection at the surgery site. You can get blood loss, more blood loss than you would in a vaginal delivery, and need a blood transfusion, and all blood transfusions always carry certain risks. You can get injuries to the bowel or bladder as the C-section is being carried out. You're at high risk of a deep vein thrombosis because you're not moving so well and you're less mobile after the delivery. There's some evidence to suggest that it can be slower to establish breastfeeding, and there's a lower rate of women who have had a C-section who breastfeed, and breastfeeding is really good for the baby. And that could be because the women are in pain and it's difficult to hold the baby on your tummy when you've got a big surgical wound there. I'm not really sure, and nor are the studies, why, but that is the evidence. Once you've had one C-section, you are at risk of having another C-section for the next baby. And each time you have a surgery through the same incision, it becomes more complicated because of scarring and adhesions. There are future risks for future pregnancies. So because they've cut the uterus, so you have a scar in the uterus which does heal, it's a weaker point in the uterus. So there's a chance that it might rupture during a future pregnancy, and that's a danger to the life of you, the mother and the baby. There can be placental problems, so they don't stick as well, or they adhere too well at the site of that scar. So there are problems in the future. And then there are some problems for baby. So babies born by C-section are more likely to have breathing problems afterwards because they don't get squished as they move down the birth canal. So all of the fluid that might be in their lungs from being soaked in fluid doesn't come out as well as it should. There can be trauma to the baby in the C-section itself, so they can actually get nicked with the scalpel, and they can actually have breathing problems later in life, such as asthma. And women who have C-sections are 3 times more likely to die. That's one study from France that showed that. And they put this down to infections, sepsis, deep vein thrombosis, and the risks of the anaesthetic. So as you can see, there are more risks to having a C-section. Although there are potentially some serious ones vaginally, so a hypoxic brain injury, for example. So it's really difficult because we all want the safe delivery of this precious gift that we've been given. And that was the decision I was faced with. So I was advised that probably a C-section was better for me because I had a reasonably small baby. And as I said, that's a risk that you find with women that have low BMIs and women that are older. They have smaller babies. There is a higher risk of stillbirth in mothers once you reach 38 to 39 weeks of pregnancy, and the placenta can just stop functioning well or stop working, and the baby doesn't have its nourishment or oxygen anymore. There's a significantly high risk of a 3rd or 4th degree tear in an older mother because your tissues are not as elastic and they tear easier, and they can be more serious tears, and a 3rd and 4th degree tear can leave you with lifelong problems. There was also a likelihood that I would be induced because the baby would have to come earlier than full term, and my last baby came at 41 weeks. And the likelihood, I was told, of that induction working was low, and then I could potentially move to having a C-section anyway, and potentially, if the baby got distressed, an emergency one. And recovery from an emergency C-section is not as easy or good as from a planned C-section. There is also a low risk of a hypoxic brain injury for baby in a C-section. So those are the things that I had to weigh up to decide whether or not to try and give birth naturally or to have a planned C-section. And I opted for a planned C-section. I was sad because I actually wanted to do it normally, if that's the right word. I wanted to do it vaginally, but I decided it was the right thing for her. And at the end of the day, for me, that was crucial. So what was the process? Well, the night before the surgery was planned, I got a call from the hospital to tell me what time my C-section was planned for, and it was going to be around 1:30 in the afternoon, and I had to go to hospital at 11:30. I had some medication to take the night before and on the morning of the C-section to stop nausea and vomiting during the procedure, and I couldn't eat or drink anything from midnight the night before. So we got to the waiting room at 11:30, and there were some other women there, and it was clear that things were running quite late, and we actually stayed in that waiting room until about 3:30. So it was quite a long wait, not knowing if we were going to have our C-section that day, and unfortunately the couple after us did get cancelled, and this was because the hospital had no beds. So if they haven't got beds for you to go to afterwards, you can't have your C-section. So you have to be prepared for that, because Obs and Gynae is an emergency service and they can never predict when babies are going to come or what's going to happen. So there's always a risk that things won't go quite to plan or to timings. So we were eventually called to theatre by a lovely midwife who talked me through what was going to happen, checked all my IDs, put name tags on, got me changed into a gown, gave my partner his scrubs to put on because he needed to be in theatre with me. And then we met the surgeon and the anaesthetist who talked us through the process, and the anaesthetist did the consenting to make sure we understood the risks that we were undertaking. Once in the theatre, we were sat on the table, I was sat on the table, my partner was next to me, with my legs dangling over and my back towards the anaesthetist. First they put a cannula in my arm, so one of those needles that stays there all of the time, a blood pressure cuff on the other arm, and an oxygen probe to make sure that I was getting enough oxygen. And then they did the spinal anaesthesia. So this is an injection into your spine to numb you from the chest down, so that you're awake in the procedure, but you can't feel any pain. Was this painful? I was terrified of the spinal. I've never had one, and it was the biggest fear for me, I have to say. So with my partner holding my hand very tight, it actually was fine. The local anaesthetic that they use beforehand is really stingy, so that was the big ouch bit. Once that local anaesthetic was in, I really didn't feel the spinal. It wasn't painful, and it was done really quickly. And I was warned that the moment it was in, I was going to start feeling heat in my bottom. And that's exactly what happened. It felt like I was sitting in hot water suddenly in my bottom. And at that point, they laid me down quickly because that's the anaesthetic taking place. So thereafter, my legs went completely numb very, very quickly, probably all the way up to my chest. So the anaesthetist used a cold spray from my toes all the way up to my armpits to make sure that I was completely numb. And I really was. I couldn't feel the spray at all. And then once it got to my armpit, I could feel it. And that was exactly what was meant to happen. The staff put a sheet up, sort of around my chest area, between me and the surgeon, so that I couldn't see what was going on at that point. And the midwife then put a catheter in for a wee. And I didn't feel it at all. And actually, I was really worried about the catheter. It's a sensitive thing to have done as a woman, I think, and a man. But I didn't feel it at all. No pain at all. And then the surgeon told me that they were about to start, which was exciting and scary. And I think I crushed my partner's hand as I waited for them to do that. So when you have a spinal, you don't feel any pain, but you can feel sensation, but not painful sensation. So I could feel pulling and pushing, but I couldn't feel any actual pain. So they cut through the skin just at the bikini line, a really tiny cut. It was about this big. They cut through the subcutaneous fat. They reach the muscles. When they get to the muscles, which are your abdominal muscles, they actually pull those apart. So the doctors either side had their fingers in the muscles and pull them apart. That just feels weird. You just feel all this pulling and pushing over your tummy. And remember, you've got that baby in your tummy, so you're very aware of it. Then once they've done that, they get to the uterus and they cut through the uterus, and then they get to the amniotic sac that the baby's in and they cut through that, and then they put their hands into the uterus and they pull baby's head out. And that all feels really weird because as they do that, they also push on the top of your bump to help push baby through the hole. And it just felt like people were dancing on my stomach. It was so strong, the pushing and pulling. I wasn't prepared for it, but it was. It wasn't painful, it was just weird. And at that point, the curtain came down so that I could see my baby's head. And there she was. Her head was out of my tummy, and it was absolutely amazing. And from that point in, they did what's called a natural C-section, and I'm going to put some links to this afterwards. So this is where actually they don't pull the baby out quickly. They leave her sitting there with her head, and they let her sort of wriggle out, and the uterus is contracting to push her out. So slowly, slowly, bits came through that hole. Her shoulder, then her other shoulder, and then her chest. And then with a little bit of a helping hand from the surgeon, they pulled her out and she screamed, absolutely screamed, which was the best sound I have ever heard. So at that point, once I've seen her, she was covered in vernix because she was a bit early, because I was 37 and 6 days, 37 weeks and 6 days, because she was a bit early. She was covered in white vernix, which is the greasy stuff that babies have on them in the uterus to make sure that the water doesn't damage their skin. So she was covered in that and she was screaming, and once I'd had a good look at her, the midwife took her over to a table to my left hand side and started doing the checks that they do on babies when they're born, just to make sure that everything is okay. And although she was away from me at that point for about 10 minutes, my partner was there with her. He got to put her nappy on and her hat. And then they wrapped her up in towels, and I could see her all of the time. So I never lost sight of her, and I could hear her, that's for sure. And then they brought her to me and put her on my chest, which was the most amazing thing ever. All of this time the surgeons are still busy, the curtain's gone back up, and they were stitching me up, and they stitch every layer. So they go through and just put everything back together and then put the stitches in. And the stitch generally, they're dissolvable inside obviously, and then on the top I had removable stitches that were one continuous stitch so that you don't get suture marks. And they put some painkillers into my bottom so that any pain that I had afterwards was controlled. And all of this time I'm holding the baby, getting covered in the sticky stuff that's all over her. She was very happy wrapped up. She didn't like to be naked, still doesn't. And she was already rooting for food. So this is when they turn their mouth to try and find a nipple. And she was doing that from the get-go. She was sucking her daddy's neck at one point. So I had baby, I'd had the surgery, it all happened so quickly, I can't tell you. And I got my last cuddle before she was put into a cot so that they could take us to recovery. I had to be moved over onto another bed, which was really weird because I couldn't feel my legs. I couldn't move them, but I was watching the staff move them for me, and it was like an out-of-body experience. I didn't think they were my legs because I couldn't feel them, so that was really weird. Once we got to the ward, we did skin to skin with the baby on me, naked with towels over her, and we know that this increases bonding and helps baby warm up. And my legs gradually returned to normal after about 4 hours. You just suddenly notice that you're moving them around. I didn't really have any pain at this point. I got out of bed and walked at 6 hours, and the catheter came out shortly afterwards. It took me a long time to pee, and I was worried about that, so I drank litres and litres, and once it started, then I peed. And that's important to make sure that the bladder has gone back into normal mode and isn't paralysed, as it were. The pain was controlled, and I was taking everything very slowly. I was very aware I had this big wound in my stomach. And I was bleeding from my vagina, obviously. I say obviously, but I hadn't thought about that. And so I hadn't bought any sanitary towels, although obviously they had them at the hospital. But you don't think about that when you're having a C-section because you think everything's going to be via the C-section. But it isn't, so don't forget that, girls. I actually came home at 20 hours. And I had pain on movement, but it wasn't too bad. And I only needed paracetamol and ibuprofen, but to move slowly. And I was moving very slowly. It's very difficult when going from sitting to standing. And I took a minute once I got to the standing position to actually slowly straighten up. And that was probably the hardest thing. It's also really hard to go from lying to sitting. So when baby wakes up in the night, you really need to think about that and take it easy. Take it really slowly. Once you're in your position that you want to be, then adjust. And it is difficult to lift baby into certain positions, so accept help, use pillows to prop you up and prop baby up. My pain got better day by day. I did have one area on the right side of the scar that was exquisitely painful, and it felt quite deep and it felt like a burning. And I've spoken to other mums, and lots of women get this. And I was aware of it all the time, and I was worried that I'd done something. But I hadn't, and then I realised one day that it wasn't hurting anymore. It had just gone away at about day 10. I did open my bowels on day 1, so that was good, but if you have opiate painkillers, you may not, and you may need laxatives, so that's important to remember. So you need to drink plenty as well. The contractions of my uterus that I got when feeding were overwhelming. They took my breath away, and that lasted for about 3 days. And that's quite hard because you've got this wound as well. So in terms of recovery, I think I'm really lucky. I was pain-free at about day 10. I'd lost almost all of my weight bar about 2 kilograms by day 12 and was back into my normal clothes by day 10. My scar was tender and is still weird. So some days I'm aware of it and it's sore on top of the skin, not deep. And there's a numbness and a tenderness. And that's ongoing, and it goes up and down, and that will be all the nerves that have been cut, and they'll be regenerating slowly, so that could go on for quite some time. I have a slight pouch just above the scar, which I must admit I was quite fearful of. It's very small, but it is there, but I intend on getting back to the gym next week, so hopefully I can work it away. My bleeding stopped at week 4, and that's quite normal. It got lighter and lighter, and I was driving by day 10. And as I said, I'm going back to the gym at 6 weeks, but you can't go back to the gym before then. You need to be sensible. So what are my tips for a C-section once you've made the decision to have one? Take painkillers at night, even if it seems that you don't need them, because when you wake up for baby, you will need them. So take the ibuprofen and paracetamol. Take laxatives if you have opiate painkillers like codeine or dihydrocodeine, and drink lots of water. Take it slowly and take help. When people are offering to help, say yes. Wear loose clothing over the scar because it is tender and there is this weirdness going on. You don't want anything pressing on it. When you do wake up in the night, if you're sleeping on your back, turn onto your side and use your arms to push you up. Don't use your stomach muscles to pull you up because that will hurt like hell. Stop for a minute when you stand up and just adjust and get yourself upright, and don't rush anything. And as I've said, when someone offers to help, say yes please. So why has my recovery been so good? Because it has been good. I'm very fit, as I think I've mentioned before. I do lots of exercise. So before I got pregnant, my core muscles and my stomach muscles were really strong. So that's really helped me with the pregnancy and I think with my recovery afterwards. So before and during your pregnancy, exercise 150 minutes a week. Do lots of core, planks and sit-ups. Get those stomach muscles working for you. Make sure you're a healthy weight and that your BMI is in range. Have a good, healthy, balanced diet. And have an active pregnancy with minimal weight gain. You're not eating for two. So I put on 10 kilos for the entire pregnancy, and that's a normal and acceptable weight gain in pregnancy. You don't need to put on lots of weight, and the more weight you put on, the more difficult the pregnancy and recovery will be. So, overall for me, having made the decision, a C-section was a really positive experience with minimal downsides, and I have a healthy baby whom I adore. Yes, I have a scar, but it's going to remind me of Alice forever, and she's worth it. It's still a major surgery with all of the associated risks of surgery, so you do need to think about it if it's what you want to do, and you need to make sure that it's right for you. It was right for me on this occasion. There are some downsides, as I've taken you through, and the recovery is definitely slower than a vaginal delivery. So I hope that's given you a perspective on my experience. As I said, it will be different for everyone. I will put some links to C-sections, risks and positives as well, the natural C-section afterwards, and also the NICE guidelines, which do say that a woman can ask for a C-section if she feels that she wants one. And I hope that's helped. Thanks for watching, and please don't hesitate to suggest other topics for me. Somebody's just suggested that I do psoriasis, so I will do that in the next few weeks. Okay guys, take care. Bye.